Did you know that almost 1 in 4 Canadians are caregivers? We just heard some of the challenges of caregivers with Emily from the Alzheimer's Society of Montreal. Almost all caregivers are unpaid, and they were most likely thrust into the role of caregiver with no formal training. It can certainly be stressful and exhausting and overwhelming. Adding to the challenge, though, is that our population is aging, and as we age, more care is required at home. However, due to this, is putting an enormous strain on our healthcare system. We're all seeing that. In fact, the number of people waiting for home care through the CLSC has more than doubled in the last 4 years to over 20,000 people. That's right, more than 20,000 people in the province waiting to get home care. Some families are waiting it out. Some children and spouses are leaving their jobs to help out, and other families are choosing to tap into the private sector or local community resources. So it is a concerning issue, and I wanted to dedicate a little bit of time to this. It's a question I get all the time. How can we access home care services better? In fact, on my next show of Life Unrehearsed, which is scheduled for the last Sunday of January, I'm going to be having Liberal MNA Linda Caron as a guest, and Madame Caron is the official opposition critic for seniors, informal caregivers, and home care. And I'm going to be talking to her not only about the challenges of home care, but we're also going to have some in-depth discussions on what the government can be doing better when it comes to our caregivers, as well as long-term care homes, such as the CHSLDs, and these ridiculous waiting lists. So, in the meantime, I wanted to focus in a little bit on home care. And if you have any questions at all about accessing home care, text me at 514-790-0800. I'll give that again, 514-790-0800, if you have any questions at all about accessing home care. So, how do we access home care through the public system? I'm going to start with the public system first. And in this case, it's going to be through your local CLSC. Okay, and you need to get an evaluation of the situation. Someone will actually go to the home to evaluate the situation. Just getting that evaluation is easier said than done. So what I suggest is if your loved one happens to be in a hospital, that's really a great time to advocate, because a hospital social worker or liaison nurse is going to be working with the local CLSC to try and get a plan set up. You could also, if you're lucky enough to have a doctor, a GP, a doctor could put in a request from the CLSC to help support at home. Or you could also reach out directly to your local CLSC center. You could simply dial them, or I always like to suggest just simply show up at your local CLSC center. You're allowed to do that. In fact, I think it's probably the most effective way, because you've got the human factors. No one's hiding behind a phone and not responding to you in voicemail jail. Just show up in person if you have the ability to do that. And prior to any of these contacts with the CLSC, I always suggest to put your thoughts and concerns in writing, because once you are on the phone or in person, things happen very, very quickly. So be prepared, and always try to focus in on the vulnerability of the person requiring the home care. If the person is living alone, you want to stress that. If you're a spouse or an adult child that's living with the mom or dad, okay, that's great. But is that person more vulnerable? Maybe you have to work full time and the person is alone. And you want to be able to show that you do not have a huge support network. So even if you do have 2 or 3 or 4 siblings, not good to show up in an evaluation with 4 siblings, because what's going to happen, they're going to see from the CLSC perspective, okay, look, there's a lot of family members that could help out this individual versus someone who lives completely alone and is more vulnerable, okay? Because the priority is going to be placed on those that are most vulnerable. If you're just joining me, Matt Del Vecchio here on Life Unrehearsed, and I'm talking about how to access home care services. And the first step is through the public system that we're talking about. And by the way, if you do get some CLSC services, don't expect much. You might be getting weekly bathing as some type of support, maybe daily medication management to make sure meds are being taken on time. That could be 2 or 3 visits by the CLSC. There might be some help with with getting ready in the morning or putting to bed, but they're in and out visits. Okay, this is not someone that's going to be with your loved one for long periods of time. We're talking in and out, 15 and 20 minutes. For some families, that's fine, but for other families, it's not nearly enough. So, actually, we just got a text come in saying, what is chèque emploi service? And it's a very good text. I get asked this question, and I like the chèque emploi service. It has its challenges and it has its problems from a bureaucratic standpoint. However, you need to know this exists. The government realizes that there's not enough CLSC workers to provide help to loved ones. So they've created what's called chèque emploi service, where they're allocating X amount of hours on a weekly basis. It's not going to be a whole ton of hours. It might be 5, it might be 10. I've seen some up to 20 and 25, very rarely that high, but there will be some hours. It allows you to hire a caregiver yourself or through an agency, and the government will pay that caregiver at those allocated hours. It's somewhere in the range of $19.50, I think it's $19.48, where they will be paying. So if you get 10 hours a week, the government will pay that caregiver directly. You don't have to worry about deductions and so on. The only thing you will have to worry about with chèque emploi service is you've got to fill out what they call a volet. It's paperwork every 2 weeks to confirm the hours that have been worked. But so ask about chèque emploi, chèque like the check, emploi like employment, and service, chèque emploi service that is offered. I often get asked, what's the difference between public and private home care? Well, first of all, cost, I would say. Public through the CLSC, there is no charge. It's free of charge. It's just, as we've just talked about, the resources are stretched really thin, difficult to get a lot of help from the CLSC. So a lot of people will go private to either just do private alone or to augment the CLSC services that they're getting. So many families will go that route. We're bringing on some private, and you can go two ways of that. You can hire someone directly, or you go through an agency. Many agencies out there, including mine, which is called Premier Home Care, but there's lots of agencies available out there in the private sector. And what I would say is, if you're hiring directly, people think that there will be cost savings. There may be, but remember, you are an employer. Okay, you're responsible for deductions, holidays, overtime, sick days, stat holidays, whereas through an agency, they take care of all that. Basically, they're the ones vetting the caregivers. They're the ones scheduling and making sure if someone is sick or a stat holiday, they have replacements for you. The obvious, a text just came in saying, but Matt, what about the cost? So what I'll do here is I'm just going to generalize, give you some ballpark figures. In the private sector, with an agency, you're going to be looking somewhere on the range of an hourly rate of $37 to $42 an hour. Okay, so it can get quite costly. A lot of people don't realize, though, but the government of Quebec offers a tax subsidy to the tune, in fact, it's going to be 40% on January 1st. It was 39%. It is 39% right now, but it's switching next week to 40%. So from a budgeting perspective, you're looking at netting out in the $22, $23, $24 range after that tax credit. Now, there are certain maximums on that tax credit, but it's important for people to know if you're considering doing some home care, hiring directly or through an agency, that those are the numbers you're going to be looking at. Now, very quickly, in terms of the services offered, sometimes there's nursing services, but most often what I see is you don't necessarily need a nurse and pay a big nursing rate. Those can be $50, $60, $70 an hour. Most of the time it's orderly or PSW or PAB, People's Aid type work, assistance with all activities of daily living and dressing and grooming, medication management, even companionship, and even doing some groceries and light housekeeping, even some laundry. So that's the type of work that's being done by some of the private agencies. And I just want to wrap it up very quickly. Do not forget that there are community resources out there. We just heard from the Alzheimer's Society of Montreal. There's this Alzheimer's Group Cummings Center. I'm on the board of Nova West Island, a fantastic nonprofit. There's Contactivity in Westmount, New Hope in NDG, and I need to mention L'Appui, L'Appui, wonderful organization offering support to caregivers.